have the news that Andy Dalton just a week to week now. Best case scenario with that thumb injury? Well, Bengals fans feeling a little bit better, but how realistic is it that he's going to return in time for the playoffs in 4 weeks? Dr. Sam Koo of Beacon Orthopadics Medicine here this morning. Doctor, good morning.
Good morning.
Okay, let's talk first the injury itself. Where would he have fractured? And I guess we could use my hand here.
Sure. From what I've gathered, Andy has a non-displaced break in his thumb, and most likely at the base of his thumb where the thumb meets the wrist bone.
Okay, now we'll look at the play again as we're looking at this. You and I were talking this out. It didn't look like that much contact. So did he have to hit this just right?
I think so. It was hard to tell on the replay, but I think he just landed awkwardly on that hand and just hit that thumb just in an awkward position to break the bone.
Now, you see this a lot in your offices, with the high school, college athletes and whatnot. Best case scenario is what Marvin Lewis said yesterday, talking week to week with Andy. I mean, in your mind, of course, you're not treating Andy, but 4 weeks, could you come back from something like this?
Sure. I truly believe this is a great news for Andy and Bengals because he doesn't need a surgery.
Yeah.
So typically a non-displaced break will take about 4 weeks for healing before he can grab grip of football and throw football. A full recovery is typically expected around 6 weeks.
Okay. Well, and this is good. I mean, depending on how, A.J. McCarron looked good in his 2 touchdown throws he got in just coming into the game. If we can buy a little time with these wins, give Andy an extra week or two. I mean, you look back, Ben Roethlisberger, he had this, I believe, earlier in the year. He came back in 2 weeks. Jay Cutler was kind of out. Is this long-term problem for him or no?
No, it's not. Once the bone heals, I think Andy will have a full career ahead of him. The big question and the concern here is to return to play and re-injuring the same thumb. As we've seen with the Cowboys quarterback Tony Romo, that is a distinct possibility.
Yeah, most definitely. And unfortunately, you got guys probably trying to go for him a little bit more.
Absolutely.
Trying to get him out there. When you talk about rehab, how long would he have to have that cast on his hand?
Typically, I imagine he's in a custom-made splint to protect that thumb for about 3 weeks, which will allow him to start some kind of motion range of motion exercises. And once the bone's healed and his discomfort is better, he'll be able to start working on the strengthening and gripping of football.
Because, that's his throwing hand, and it's the grip that has you right there.
Absolutely. If the bone is not healed and not where he continues to have discomfort, it will definitely affect his accuracy and throwing velocity because the thumb is such an important digit in your hand when you're throwing it, especially this is his dominant hand.
How much pain? I mean, is it real painful? Or?
For now, as long as you're not gripping it, using that hand, he shouldn't be in too much discomfort. Yeah. But the question is, in 3 to 4 weeks, how will he feel when he's trying to throw the football to his receivers and running backs?
Okay, so worst case scenario would have been surgery and whatnot out for the season. Looks like we may have dodged a bullet here as long as we can get another win or two in here of these next 3 games.
Absolutely. I think as a fan, I hope that the Bengals will win out and get an extra bye so that he can heal.
That's good point. And somebody was telling, not a sports expert, but somebody was telling me this week, and we should root for the Steelers so that they beat the Broncos because of
Absolutely. I mean, that's in 2 weeks we're going to be playing the Broncos in Denver, so that's going to be a big.
Doc, I got to wrap it up, but you should be a sportscaster. You've got it down. That was